Hello guys. Welcome back to our channel. We hope you all are safe and healthy. Prayers with those battling with health diseases. Once again, Wellbeing is here with another interesting video educating you guys about the prominent and most dangerous lung diseases which are fatal. These diseases affect the respiratory system of the victim, hence troubling them to breathe properly. Among this pandemic, we consider it extremely important for each individual to have strong knowledge of all such disease, including COVID-19. So let's start the video, but before diving in, click the subscribe button and the bell icon to stay tuned with our latest and upcoming videos. 1. Chronic obstructive pulmonary disease. More commonly known as COPD, the chronic obstructive pulmonary disease is a respiratory illness that causes difficulty in breathing or exhaling. The most common symptoms are coughing and mucus from the lungs apart from breathlessness. This disease begins in 30s or 40s and peaks in the later 50s and 60s. Since this is another old age problem, it is often difficult for patients to identify it, and mostly it is taken lightly just as an aging process or body deterioration. For that reason, Dr. Meyer says COPD often goes undetected for far too long. This disease is generally associated with cigarette smoking. It's rare to see people with COPD who haven't been exposed to some sort of smoking. People can experience varying severity levels of COPD. At its most severe, it can cause people difficulty doing everyday activities. COPD treatment includes smoking cessation, bronchodilator therapy and pulmonary rehabilitation, which is a supervised exercise program for people with COPD. According to the American Lung Association, COPD is the third leading cause of death in the U.S. Dr. Meyer identifies COPD as one of the most serious and dangerous respiratory illnesses. It is an irreversible disease. 2. Asthma. Another common but chronic lung illness is asthma that causes trouble in breathing because of inflammation of the airways. Asthma symptoms include dry cough, wheezing, chest tightness and shortness of breath. There is a major connection between environmental allergies and asthma. Allergic reactions, infections and pollution can all trigger an asthma attack. During an attack, the victim needs to have a rescue inhaler that opens the airways quickly to resume breathing. However, unlike COPD, asthma is reversible. It usually appears in the childhood and increases during the adulthood. But there is a cure to this, which if applied, terminates it permanently. 3. Chronic lower respiratory disease. Also known as CLRD, the chronic lower respiratory disease is more severe than COPD and the fourth leading cause of death in the U.S. Typical symptoms across most of these conditions include shortness of breath, wheezing, increased mucus, sputum production, chronic cough, racing heartbeat, fatigue. Even COPD, asthma, emphysema and chronic bronchitis is a symptom to the former disease. The major cause to CLRD is smoking, as a research shows that 80% of the patients had a history to smoking. However, exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections can also play a role in its development. More than 50% of the patients to CLRD are above 50 years of age, and mostly women. 4. Chronic bronchitis. Chronic bronchitis is a type of COPD, also identified as its symptom. But it is not a long-term or permanent disease, rather an infection which can be treated by the right antibiotics, though it can't be completely cured. Chronic bronchitis is inflammation, swelling, and irritation of the bronchial tubes. These tubes are the airways that carry air to and from the air sacs in your lungs. The irritation of the tubes causes mucus to build up. This mucus and the swelling of the tubes make it harder for your lungs to move oxygen in and carbon dioxide out of your body. As a disease of the lungs, their main cause is quite similar to the causes expressed for the former diseases: smoking and other environmental and chemical exposures. A few people have chronic bronchitis in their genes as a gift of their ancestors. So, the next time you smoke, just remember you are not just putting your life in danger, but your children's and grandchildren's life as well. 5. Emphysema. Emphysema is another type and symptom of COPD. In emphysema, the air sacs in the lungs called the alveoli are damaged. Gradually, the inner walls of the air sacs become weak and rupture, thus creating larger air spaces instead of many small ones. This reduces the surface area of the lungs and, in turn, the amount of oxygen that reaches your bloodstream. When you exhale, the damaged alveoli don't work properly, and old air becomes trapped, leaving no room for fresh oxygen-rich air to enter. So, this causes breathlessness. Its symptoms are breathlessness, which begins gradually, so they are difficult to identify. Over time, as it increases and peaks, Emphysema causes shortness of breath even when you are resting. Its major cause is also smoking and exposure to chemical and harmful gases. 6. COVID-19. COVID-19, also known as the coronavirus, is the 2020 pandemic. We are all in it together. Many lives have been lost and many are still battling, whereas we also have a huge number of survivors and recoveries. It's the most dangerous lung disease in these times as the vaccination is still not discovered. Though it has been an old disease with very few patients in the past, the sudden outbreak has increased its havoc. Signs and symptoms of coronavirus disease 2019, COVID-19, may appear 2 to 14 days after exposure. This time after exposure and before having symptoms is called the incubation period. Common signs and symptoms can include fever, cough, tiredness. Other symptoms can include shortness of breath or difficulty breathing, muscle aches, chills, sore throat, loss of taste or smell, headache, chest pain. This list is not all-inclusive. Other less common symptoms have been reported, such as rash, nausea, vomiting and diarrhea. Children have similar symptoms to adults and generally have mild illness. Some people may have very few and light symptoms, and some none at all, and the virus is only identified as it reaches its peak. If you have emergency COVID-19 signs and symptoms, seek care immediately. Emergency signs and symptoms can include trouble breathing, persistent chest pain or pressure, inability to stay awake, new confusion, blue lips or face. The virus appears to spread easily among people, and more continues to be discovered over time about how it spreads. Data has shown that it spreads from person to person among those in close contact, within about 6 feet, or 2 meters. The virus spreads by respiratory droplets released when someone with the virus coughs, sneezes or talks. These droplets can be inhaled or land in the mouth or nose of a person nearby. It can also spread if a person touches a surface with the virus on it, and then touches his or her mouth, nose or eyes, although this isn't considered to be a main way it spreads. The best way to prevent catching is to stay clean and avoid mass gatherings and unnecessary touch. We hope you enjoyed the video. Don't forget to like it, and tell us in the comments section what precautions you take to avoid these diseases.